getting into medicine was kind of that perfect mix of, helping people that were really sick and then using my science skills together. My primary specialty is pulmonary diseases, but then I also have specialties in critical care medicine and sleep medicine. I see patients both in the hospital and also patients in the office. In the hospital, we primarily work out of the intensive care unit, so we're dealing with critically ill patients in that type of a setting. We'll also do inpatient pulmonary consultations where we are seeing patients who have complex lung disorders and kind of assist with their management. We do have a consultation service, so people will be admitted to a primary service and then we'll be asked to see them if they have complex lung problems. In the office, I will see patients with lung diseases and then also patients with certain types of sleep disorders. Usually the symptoms start with shortness of breath or cough, and then we'll kind of work from there. We do specialize in smoking-related lung diseases and a lot of emphysema and chronic bronchitis and COPD, so that's a big part of our patient population. Also asthma and what we call reactive airway diseases or wheezing type things. We'll also treat patients with lung cancer and autoimmune lung diseases as well. We'll do a little longer visit the first time, and it'll be an intake thing where we'll assess people's symptoms and work on trying to figure out what we call a differential diagnosis, which is a list of likely culprits for why people are having the symptoms they're having. Then usually it'll involve getting people set up for some sort of testing. Commonly we'll order lung function tests or breathing tests. We'll do imaging, which can be as simple as a chest x-ray or as complicated as, CAT scans or nuclear medicine testing for different types of things. And we'll start to try and put together a list of what could be causing somebody's symptoms with those tests and our physical exam findings. Unfortunately, a lot of times what we see people for is abnormal imaging, and that can be related to cancer or some more serious diseases. So in that situation, a lot of times we'll end up kind of building a treatment team and then kind of quarterbacking, if you will, that team and making sure people get to, the right specialties to kind of treat their complex illnesses. By nature of what we do, we usually end up having a pretty close relationship with our patients, coming up with a individualized treatment plan and then working with them over time to achieve our goals. Well, I spend a lot of time here, but whenever I'm not, I'm usually with my family.